afternoon. I'm Hillary Armstrong, a Public Information Officer with the County of Santa Clara Emergency Operations Center. Thank you for joining us this afternoon. We are here and joined by the health officers for the counties of Alameda and Santa Clara to discuss the first two cases of the South African variant of COVID-19 identified in California. Providing you with updates and information today will be Dr. Sarah Cody, Health Officer and Director of Public Health for the County of Santa Clara, and Dr. Nicholas Moss, Health Officer for the County of Alameda. Following statements by Dr. Moss and Dr. Cody, we will be taking question and answer from the media. When that time comes, I will ask media to please raise your hands using the hand raise function in Zoom, and I will put through a request that will ask you to unmute yourself to ask your question. Please also identify the media outlet you are with. Following the conclusion of the English and ASL portion of our press conference, we will go on to statements in Chinese, Spanish, Vietnamese, and Tagalog. Thank you very much. And with that, I will hand it over to Dr. Sarah Cody.
Thank you, Hillary, and good afternoon, everyone. Today, we want to share with you what we know about a case in our county, a resident of our county, who we learned this morning had been identified as carrying the strain of SARS-CoV-2, that's the South African variant. So this is an adult who had traveled internationally, returned in mid-January, and then per the mandatory quarantine requirement in Santa Clara County, quarantined after travel along with a household contact. Several days after return, developed symptoms, was tested, and then just this morning we learned that the genomic sequencing results showed that the SARS-CoV-2 was the South African variant. Our understanding is that this case in Santa Clara County, along with another case in Alameda County, that these are the first two cases of the South African variant to be identified in California. I want to emphasize we have begun investigating. We have not completed our investigation, but the encouraging news from our end is that this person, upon returning, immediately quarantined. And therefore, we don't know of any opportunities for further spread within our community. And after Dr. Moss, of course, I'm happy to answer any questions. Thank you.
Good afternoon. I'm Dr. Nicholas Moss, Alameda County Health Officer. An Alameda County resident with COVID-19 infection diagnosed in January was also found to have had the B1351 variant, otherwise referred to as the South Africa variant, and reported to Alameda County overnight. Our investigation is still in progress, but we can say this person is no longer infectious to others. We have no evidence of other B1351 variant cases in the county at this time, but we have a limited picture. Only a small fraction of COVID specimens are sequenced in the US, although this number is increasing. Efforts are underway in Alameda County and across California to systematically improve surveillance for variants of concern. We expect to receive more reports from labs detecting such variants in the coming weeks. For all CDC variants of concern reported in Alameda County, we investigate the case, ensure isolation and quarantine requirements are followed, and we investigate for exposures that may have led to infection, as well as for potential for ongoing spread. COVID rates are improving with the resolution of the winter surge, but rates remain high and higher still even than the peak of the summer surge. Residents are strongly encouraged to take all precautions we now know prevent the spread of COVID-19, including face coverings, physical distancing, and limiting gatherings with others. Thank you.
Thank you very much. And with that, we will now proceed to question and answer. Our first question comes from Lisa Krieger from the Mercury News. I'm going to send you a request to unmute.
Thank you. Can you hear me?
Yes, we can.
Terrific. Thank you. Can you tell us if the two cases are related to each other? And then
Lisa, you broke up a little bit. Could you restate?
are the two cases related? And then the
I'm really sorry, Lisa. We seem to have a bad connection with you. Perhaps we'll go to the next question and then we'll come right back to you.
And I'll send you my question. Yeah.
Oh, now we can hear you.
The question is, are the two cases related? And the Alameda County case have a travel history?
So this is Dr. Cody. Thank you for your question. To best of our knowledge, our investigation so far, we've not found any connections. However, as Dr. Moss stated, they are quite early in their investigation. We have a bit more detail than they've have so far. No evidence so far that they are related to each other.
Yeah, I would just add that this is under investigation, and that's exactly the kind of thing we'll be looking for, but we don't have anything to share at this time.
Thank you. Our next question will be from Dan Kerman with KRON. I'm sending you a request to unmute.
Yes, first question is for Alameda County. Why do you have so little information already in terms of the travel history? That would seem like a phone call. And for Dr. Cody, you talk about that this person went into isolation right away, and that's the good news. Talk about the different scenarios in terms of the spread of this and why this is better than something else.
I'll start and then turn it over to Dr. Cody. So these investigations take time, and we were made aware. We really received this information effectively this morning, and they are not instantaneous, and they never are. But we wanted to make sure that the public was aware, and we know that others were sharing this information, so we wanted to share what we could.
Can you restate the question for me? I apologize. About what we, I guess I could say just again.
Okay, no, that's fine. They just unmuted. They just unmuted me, so I can restate.
Thank you.
What I wanted to know was talk about the various scenarios in terms of what would be helpful and what would not be helpful. For example, in this case, you said it would be helpful if this person went right into quarantine versus being around others. What is the fear about the spread of this had that not been the scenario, or if that turns out not to be the scenario in Alameda County?
Well, let me just say, I want to echo a few of the opening comments that Dr. Moss made. One is that there are a few variants of concern. The South African variant is one of those. There's different concerns about each variant. And so the key is to be able to pick them up. And we do that through genomic sequencing. So in our case, both a specimen from Santa Clara County as well as Alameda County were picked up through sequencing done by Dr. Ben Pinsky's lab at Stanford. And so now that we have the information, the question is, what can we learn? And I wanted to just reiterate that in our county, we have a mandatory travel directive. That means that anyone returning from travel that's greater than 150 miles from the county border must quarantine for 10 days. So this individual had international travel, returned to our county, and was 100% compliant with that, stayed in their apartment, and several days after returning, then developed symptoms, got diagnosed. So the good news is that at no time during their infectious period were they in contact with anyone outside of their household. So that is encouraging to us in that for this particular case, we have no evidence that there was any further risk or spread within the community. However, this is really important to know, is that we don't do this sequencing on every positive specimen. And so in some ways, we sort of have to assume that perhaps these variants of concern are already circulating. We just don't know to what extent. And so we need to adapt and change our behavior and really double down on all of those important things that we're doing, like wearing masks, not gathering inside with anyone outside of our household, and keeping our distance, because we certainly don't want any of these variants, if they are here, to spread any further. And that's really, really, really important.
Thank you. Our next question will come from Courtney Teague with Patch. I'm going to send you the unmute request.
Hi there. Thank you so much for doing this. A couple of questions. Can you say more specifically what communities these patients were from? And if not, why not? And regarding the Alameda County patient, do you have any indication that this person was in contact with others? And if so, how many people?
We typically don't share that level of detailed information down to the individual community level with these types of investigations. And we're just sticking with our normal policy in this case. And then we don't have that information at this time because the investigation is in process. And then I also wanted to make another comment in response to the last question, just about variants in general. The information about variants comes, not only do we not have it on every case, in very few cases, but it also comes much later because it takes time for the labs to screen and then run all the testing necessary to have this information. And so we don't get this information at the same time that we get in the same way that we get regular COVID case reporting information.
Thank you. And our next question will come from Ron Lin with the LA Times. I am sending you an unmute request.
Hey, doctors. Thanks so much for taking our questions. Really appreciate it. The South African variant has caused substantial concern because, as Dr. Fauci has said, our current vaccines are less efficacious against it. Should members of the public be doing anything differently now that we know the South African variant is here, like double masking or making our masks fit better? And should counties or the state be altering public policies, such as the statewide mandatory travel quarantine policy, as is the case in the Santa Clara and LA counties? Thank you.
I can start. And so the most important thing with these variants for people to realize is that all of the tools that we already have available to us to prevent the spread of COVID work, including face coverings, physical distancing, avoiding gatherings, hand washing. There's really no reason to stop doing those things. And in fact, just the opposite. They're as important now or more important than ever, because they can limit the spread of any variants in our communities. And then in terms of the vaccine efficacy, so the vaccines available in the US should still, are expected to still protect against infections caused by this variant. There may be some variability. We'll be interested to see if there's more data that comes from the manufacturers, but the early evidence suggests that they will continue to provide protection. But there are also many other COVID, they are still likely a small proportion of what's circulating here locally. And it's important to realize that the benefits of the vaccine will extend across all of the COVID variants that are circulating, including ones that we've had locally for some time.
Thanks for the question. I would just add that the fact that we now have documented that this variant is circulating in California, we already know the UK variant is circulating in California, We know that this virus will continue to adapt and change. That's its job. And so I think that what this information does is it really underscores how important it is, even though we're tired, even though we've been doing this for a year, that we have to continue to take all of these precautions and wear a mask and not gather indoors and wear a mask consistently. That's really, really, really important. Like, don't take it off to have a snack unless you're by yourself or outside with a family member. Wear your mask. So if anything, I think that the fact that we've now documented them, maybe that will help change behavior in the public. I certainly hope so. And I would say that, so in Santa Clara County, it's mandatory. This is a travel directive. It's a health officer order that after travel, you quarantine for 10 days. But statewide, it's an urgent recommendation. So the action that we want the public to take actually is the same across the state. We just underlined it with a health officer order.
Thank you very much. Our next question will come from Paul Rogers with the Mercury News. I'm sending you an unmute request. And
thanks very much. Few quick things. Where did the Santa Clara County person travel to? Number one. Number two, in Alameda County, you mentioned that the person is no longer infectious to others. How do you know that? Have you spoken to the person? And then finally, how big of a spike in cases due to these variants do we expect in the coming weeks or months? Thank you.
So I could start. The travel history for the Santa Clara County case is a bit complex, and we're still filling it in. So I don't have particular details to share, but what I can tell you was that the individual did travel internationally, and that they were not infectious while they were traveling. Their infectious period started after they were back home, and that's why we fortunately are not concerned that they exposed anyone. But the question is, of course, where did the infection come from, and that is still under investigation. And you're going to have to restate the rest of your question, or I'll hand it off to Nick, who may remember. Dr. Moss.
Yeah, so the question for Alameda County was how we know that the person is no longer infectious. And that's because we have the date that the lab test was performed, and that provides enough information at this time to make that judgment. And then in terms of the risk of future surges, I think that there is a risk. We certainly should expect that more surges will come. They may look different. We'll be moving out of winter here in California. More people will have received vaccine or will have had past infection that could affect things. Many more older adults will have been vaccinated, which could should affect positively the impact on our healthcare systems. But nevertheless, many people have not had COVID infection, and I do think that that means that there is a risk of continued surges, and all the more reason to keep doing the things that we know keep each other safe. And I think that's true regardless of the situation with the variants. Certainly, there's concern with the UK variant and reports of increased transmissibility contributing to future surges in the US. But regardless, I think that the risk is there no matter what variants that we're talking about, and people need to, again, stick with the things that we know work to protect each other.
Have you or your staff spoken with the Alameda patient, though?
I have not spoken with the Alameda patient, and still waiting for the latest report back from our staff.
thank you. Our next question will come from Kate Larson with ABC7. I'm going to send you an unmute. Kate, did you still have a question?
Yes, can you hear me?
Yes.
Hi there. Thank you for answering our questions. I was curious about the condition of both the Santa Clara and Alameda patient, if they're doing okay, given that we've heard that these variants are perhaps more contagious, but not necessarily more severe or result in more severe infections. My other question, I'm hoping you both can clarify this. Governor Newsom said on January 29th, or this is when we reported it, that the Brazil variant had been detected in California. I know we're talking about South African, but this also came out of the same Stanford lab that detected these South African variants. But then today, earlier, he said that the Brazil variant is not in California. So I'm curious if either of you can clarify that question as to whether the UK, South African, and Brazil variants have been detected in the Bay Area and or California. And then I'm wondering if either of you at this point can answer how this might impact vaccine distribution and immunity. Will people who have already received the vaccine at some point need to receive another vaccine once Pfizer and Moderna and Johnson & Johnson, assuming EUA, release an adjusted vaccine to protect against these new variants? Thank you.
So to your first question, as to how ill was our case never required hospitalization, recovered at home, and is fully recovered now. So this was not a severe illness. I really can't speak to detections of the Brazilian variant in California. I can just say that not as yet detected in Santa Clara County.
And for Alameda County, again, investigation underway, so can't make any comments about the severity of the particular infection. But with regard to other variants, a couple things. I can't speak for the state. I think questions for state remarks should go to the state. But generally, speaking more generally, there is a variant of concern that is sometimes referred to as the Brazil variant, P1. It's also referred to sometimes. And then there's another variant of interest that has been associated with the country of Brazil. And that may have been a source of confusion, but there are actually two different variants. And then we do have, I believe it's now 7 total reported cases of the UK variant in Alameda County. All of those, either directly or indirectly, appear to be related to travel outside of the county, and in fact, outside of the country, or at least outside of the state. But again, we have a very limited picture of the extent to which these are impacting our communities. You know, there are many specimens out there that have simply not been sequenced. And then in terms of the boosters, I think the early information from scientific researchers is that the currently approved vaccines in the US, the Pfizer and Moderna vaccines, should have good or excellent efficacy against the strains circulating here, including these variants. Even if they're somewhat reduced efficacy in some cases, overall it is still very good. But I think prudently, the manufacturers and others are looking at booster strategies, should they be necessary, either for these or for other variants that could emerge before we were able to collectively get this pandemic under better control.
Thank you. Our next question will come from Tayana Garcia with Univision. Tayana, can you unmute yourself?
Yes, can you hear me?
Yes, we can.
Okay, I don't know if you guys can hear me, but
we can hear you.
So it is also known that these variants are more contagious than the original COVID. How so, and what is expected with the vaccine as such? And also, can you give us specifics as to where these people came from? You've mentioned internationally, but is there a possibility to know exactly where? And I did send a list over.
I'll speak to the first question and then turn it over to Dr. Cody.
Questions.
In terms of contagiousness, there are varying estimates of the contagiousness of different variants. The one that has been where we've got the most information and that has been of greatest concern has been the UK variant. These are just estimates, but it does appear more infectious than the strains that were circulating in the UK before it emerged. And there is recent data to suggest similarly true in the United States, that it could replace other circulating strains. How much more infectious, I think, is a matter is still really an open research question, but it is reasonable to expect that it's more infectious than other circulating strains. Again, I would just highlight that the same prevention measures still work, but it's all the more reason to be diligent about using them.
I would echo the same message. The truth is, as we've said before, we should expect that the virus will continue to adapt and change. And so it is important that we continue to do everything that we can to prevent every opportunity for spread. And that means consistently masking and keeping our distance from others, and certainly, and very importantly, quarantining after travel to another area. That is what has prevented spread from this case further into the community here in Santa Clara County. As I mentioned before, our case in Santa Clara County did have a history of international travel. The history is rather complex, and so we can't share any further details now, but we will continue to gather information as we put the story together. Of course, we will share during later updates.
Thank you. We have time for a couple of more questions. We are handling questions in the order they were received and are doing our best to get to everyone. So thank you for your patience, and we can always follow up. Our next question will come from Erin Alday with the Chronicle.
Time with me. I know you're really busy, so we really appreciate it. Just a question. I know that you've said that it's obviously really important for everybody to do the social distancing, the practices we know of, but can you speak to the importance of really kind of increasing our surveillance, increasing our screening and sequencing so we can identify these particularly troublesome cases very early and kind of, form that contact tracing investigation around them and get those kind of isolated and taken care of really quickly? Is that on the table? Is that something that is possible to do and that we should be doing?
Thank you so much for the question. I have to say that this does remind me a little bit of our early days of testing, where we had very little testing and it was so focused. I'm sure you remember that we were only testing people who were hospitalized with a travel history because we simply didn't have the capacity. And a year ago, I remember that very uncomfortable feeling, thinking that, there's got to be cases out there and we just can't see them. I think it is a similar story with genomic sequencing. There is not a standardized, consistent, population-based approach across the country. We are trying to build an approach across the state, but it is a patchwork of different types of labs. Some counties are able to submit more specimens for sequencing than others. The County of Santa Clara is, for a variety of reasons, able to access more labs for genomic sequencing as compared to many counties, but it is still just a small fraction of the cases that we identify every day. So we are indebted to academic labs who support this work. And again, I want to emphasize and thank the lab at Stanford that did the sequencing and reported it to us so quickly after they got the result. There are other academic labs and other partners that are doing this as well. And there's a database, but the capacity, sort of broadly speaking, across the state and the country just isn't what it needs to be in order to rapidly identify and track emerging variants.
Hello.
Hello.
Okay. So I am wondering if, with so much unknown about the variants, are we moving too quickly on reopening? There's a lot of pressure to get schools reopened, a lot of pressure to reopen the economy and businesses. What would you advise with so little known and with the belief that there are more cases out there?
I think, the good news, to put a positive spin on this, is that we know a lot more than we did at the beginning of the pandemic. We have more tools and more nuanced tools than we had a year ago. And so we know more about what kind of masks work and why they work. We know how important ventilation is. We know how important filtration is. We know that a primary mode of transmission is through aerosols, those fine little particles that can kind of linger and float in the air. None of that was really clear to us a year ago. So we know what steps we need to take. I think the biggest challenge is to ensure that everyone is willing and able to change those behaviors all the time. That really is the key challenge, and it's a challenge now, and I think that it's going to be more of a challenge going forward with these new variants, that may be coming online to a greater or lesser extent. We're not quite certain yet. So as with everything, I think it's, we still do need to be cautious. As Dr. Moss mentioned, case rates are declining. However, they are still really high. They are still far higher than they ever were, even during the summer peak. So we are, we're still in a pretty big pickle. That's the truth. And so I don't think we have that much room to move. That being said, as far as schools, I know our local data for the schools that we have had open, which are primarily K through 5 or K through 6, we've seen very little transmission in the schools. So the schools have been able to apply the safety measures and the safety protocols and prevent the vast majority of spread within schools. So that's a bit of good news. I don't know if Dr. Moss, you'd like to add.
I'll just add that in terms of monitoring case rates and the state's blueprint for a safer economy that we use to regulate reopening, those case rates are we should still be able to detect these variants with current testing based on what the FDA is saying about the available tests and the variants themselves. And so case rates falling, that's true regardless of what is circulating here in the counties. Again, rates remain very high, but also I think, although some reopening has happened, we remain at a time where there are a lot of restrictions in place. And I think this is all the more reason for people to abide by those. I know it's been a difficult year and a year of a lot of sacrifice for residents across the Bay Area, but they are extremely important. And even though some things have opened up, a lot of things remain closed. And let's try to stick with that. We'll watch what happens with the pandemic. in terms of case rates, impact on our healthcare system. And I think we should be prepared that if things start moving the opposite direction, we might also have to increase restrictions again. That's simply the situation we're in.
Our next and second to last question goes to Molly McRae of KPIX. And unfortunately, we won't be able to get to a second round of questions for outlets today, but you can always follow up with us. So Molly?
Can you guys hear me? I assume?
Yes, we can.
Okay, great. So could you let me know, with both the cases, were they selected randomly to be genomically sequenced, both in Alameda and Santa Clara County? And Dr. Moss, where was the Alameda County case sequenced? And finally, just any idea that you may be doing dosing differently if we're seeing more of these variants proliferate around the Bay Area?
The Alameda County variant was sequenced at Stanford, Dr. Pinsky's lab, same as Dr. Cody's, and I think they can address this more directly. My understanding is they have a strategy for screening everything that is tested at their lab, and then they can do additional testing if those screening tests suggest there may be a variant. So it wasn't anything specific to our case that resulted in this, but rather their overall approach. And I'm sorry, I forgot the rest of the question. You have to remind me.
Oh, do you think that there's going to be any kind of reconsideration of how dosing may occur if we see more of these variants proliferate at all? And what I mean, instead of just giving out the single doses first before completing one vaccination with 2 doses?
Well, I think the most important thing with dosing is that it should be, really evidence-based and driven by what has been shown in ideally in the clinical trials. That's why they're done. And I think if a good clinical data suggests that there's a more optimal dosing strategy, either for these variants that we're talking about today or any COVID, I think we'll all be interested to see that. But for the time being, I think letting the high quality clinical trial data guide us is where we are, and right now that is not yet suggesting any change in dosing strategy. I think at least here in California.
Thank you. And our final question today will go to Janie Har with the AP. Janie, can you find your unmute?
Oh, can you hear me?
Yes.
That was hard. Thank you all for your time. Dr. Cody, if I'm hearing this right, it sounds as if 2 members of the same household traveled, but only one was diagnosed with a new variant. And did you say that that person did not contract the virus while traveling? And secondly, your county executive said yesterday that he'd like to opt out of MyTurn, the state's new appointment system. Can you elaborate on why? Thank you.
Thank you for your question. So a little bit more detail on our case in Santa Clara County. Our case in Santa Clara County traveled, returned, became ill, got tested. The case has a household contact, one household contact. That household contact also became ill, but wasn't tested. That household contact also had a travel history. So that's why but it is a presumed case, but that's why this is complicated in our county as far as the exposure and the travel history. So you're correct. One confirmed, one presumed. They are household contacts and both have a travel history. And both, very importantly, and I really need to underline this, they were exquisitely compliant and immediately from travel, they went nowhere outside of their home. They had food delivered. They were extraordinarily careful and prevented, best we can tell, really don't have any concerns about further transmission in the community. Thanks.
I had a follow-up on my turn.
Yeah, I don't really have information to help with that. So I can't really answer that question right now, but sorry about that. Perhaps a follow-up with the PIO team.
The PIO team would be happy to follow up with you on that. This concludes the English and ASL portion of our media availability today. Thank you so much to our team and our ASL CDI interpretation team. And thank you to Dr. Cody and Dr. Moss for joining us today. Thank you to our partners in the media. At this time, we will proceed with statements from our team at the PIO and the EOC here. Today, we will begin with Chinese, and then we will move to Spanish, Vietnamese, and Tagalog. Thank you very much.
大家好，我是 Ann Chang， 圣塔克拉拉县紧急行动中心的公共信息官，在此宣布重要的新冠讯息。近日，由史丹佛大学的基因序列实验室发现，在圣塔克拉拉县和阿拉米达县发现了2宗南非新冠变异病毒株案例。在圣塔克拉拉县，患者是1月中从国外旅行回来的2位县居民，他们遵守规定，旅行返回后在家进行10天的居家检疫，也在感染期进行了隔离。阿拉米达县的案例还在调查当中。我们正在快速的了解情况，目前最好的防疫方法还是保持高度的警觉，来降低传播。一般情况下，病毒会适应环境，制造出更多的变异，来增加传播的机会。卫生官员强烈不建议出行，并且建议大家不要和不住在一起的人士在室内碰面聚会，来降低暴露于病毒的风险。CDC 也在今天宣布，数据显示，戴2层口罩能够更有效地防止病毒的传播。请大家继续采取防疫措施，尽可能的待在家里，出门时戴口罩，不要和不同住一起的人在室内聚会，和他人保持至少6英尺的身体距离，并且经常的洗手。祝大家平安健康。Next, Ricardo will be providing the statement in Spanish.
Thank you. Hola, ¿qué tal? Muy buenas tardes. Mi nombre es Ricardo Romero Morales. Soy oficial principal de información pública para el Condado de Santa Clara. El día de hoy acabamos de anunciar que los primeros casos identificados en California de la variante sudafricana se han detectado localmente. Uno en el Condado de Santa Clara y otro en el Condado de Alameda. En estos casos, lo que sabemos es que la persona y un miembro del hogar, con respecto al caso de Santa Clara, la persona y un miembro del hogar regresaron recientemente de viaje internacionales a mediados de enero y experimentaron síntomas varios días después de haber regresado. Estas 2 personas del condado de Santa Clara siguieron la directriz de cuarentena de viaje de quedarse en casa 10 días después de haber regresado de sus viajes internacionales. El caso en el condado de Alameda sigue siendo investigado. Hasta en este momento no tenemos muchos detalles sobre este caso. Este es un ejemplo de la importancia de cómo las medidas de salud pública pueden ayudar a romper las cadenas de transmisión y por qué es tan fundamental que nosotros como comunidad sigamos esta directriz. También los 2 casos fueron detectados como parte de los esfuerzos de secuencia genómica a través de los laboratorios de la Universidad de Stanford. Es importante recalcar que actualmente solo una fracción de los casos positivos de COVID-19 se secuencian a medida que el condado y sus socios trabajan activamente para aumentar la capacidad de secuenciación. Es por ello que es muy importante recordarle a nuestra comunidad la importancia de usar su cubrebocas, mantener ese distanciamiento social de más de 6 pies y también tratar de evitar las reuniones en los interiores. Muchas gracias.
And we have a question from Tayana Garcia.
Yes, Ricardo, ¿cómo así que 2 de las personas que regresaron en el condado de Santa Clara, ambos sintieron síntomas, pero solo a uno se le hizo este examen de secuencia genómica. ¿Por qué? ¿Y cómo es que funciona?
Así es. Actualmente solamente una fracción de los casos positivos a COVID-19 se usa la secuencia a medida que el condado y sus otros socios también están trabajando para aumentar esta capacidad de secuenciación que tenemos en asociación con la Universidad de Stanford. La razón en que en este caso una persona fue diagnosticada con esta nueva variante y la otra persona por asociación también estamos asumiendo que posiblemente tenga también esta variante debido a que las dos personas viajaron internacionalmente.
Entonces serían 3 casos en vez de 2, ¿no?
Hasta ahorita los confirmados son 2 casos. El otro caso no es confirmado, pero podemos asociarlo con el caso positivo de Santa Clara.
Gracias. Oh, we have one more question from Erica Vasquez.
Can you guys hear me? Can you guys hear me now? Sorry. Me acabo de conectar con ustedes, entonces estoy tratando de entender lo que está pasando. Cuéntenos qué tan diferente es la variante que encontraron en Sudáfrica a la de Inglaterra.
Hasta ahorita lo que sabemos es que la variante de Sudáfrica también es más contagiosa, al igual que lo que sabemos de la variante del Reino Unido. Hasta en estos momentos aún seguimos aprendiendo más información acerca de esta nueva variante. No sabemos mucho, es por ello que la recomendación que le estamos haciendo al público en general es de que por favor sigan manteniendo ese distanciamiento social de más de 6 pies, usar su cubrebocas y también evitar reuniones en los interiores. También es muy importante recordarle a la comunidad de hacerse la prueba de COVID-19. Sabemos que mucha gente ahorita, ya que empiezan a bajar los casos, posiblemente gente está haciendo planes para salir de viaje. Solamente también se les quiere recordar que tenemos una directriz, la cual indica que si las personas viajan más de 150 millas fuera del condado de Santa Clara, tienen que ponerse en cuarentena por al menos 10 días y hacerse la prueba de COVID-19 alrededor del día 6 o 7.
Thank you. And now we will move to our statement in Vietnamese.
Xin chào quý vị, tôi là Khánh Ly, là nhân viên truyền thông của quận hạt Santa Clara. Buổi họp báo ngày hôm nay được tổ chức để đưa đến quý vị thông tin về 2 trường hợp nhiễm biến thể Nam Phi B1351 của SARS-CoV-2 đã được xác định ở tiểu bang California, chi tiết hơn là ở hạt Santa Clara và Alameda. Trường hợp nhiễm tại Santa Clara là do có người đã cùng với một người khác trong gia đình đã đi từ đất nước khác trở về vào giữa tháng 1 và bắt đầu có triệu chứng sau đó vài ngày. 2 người này đã tuân theo hướng dẫn của hạt Santa Clara cách ly 10 ngày sau khi trở về và tự cô lập tại nơi họ sống trong suốt khoảng thời gian bị lây nhiễm. Trường hợp bị nhiễm tại hạt Alameda đang được điều tra nguyên do. Đây là một ví dụ điển hình về tầm quan trọng của việc tuân theo các thể thức an toàn mà Sở Y tế đưa ra để ngăn chặn sự lây lan, và nếu như tất cả mọi người trong cộng đồng đều có thể làm được điều này thì chúng ta sẽ có thể hạn chế được tối đa các ca nhiễm. 2 trường hợp được xác nhận thông qua giải trình tự gen tại phòng thí nghiệm của Đại học Stanford. Hiện tại chỉ một phần nhỏ các trường hợp dương tính với COVID-19 được giải trình tự gen mà thôi. Và quận hạt cũng như là các đối tác cũng đang cố gắng mở rộng cái khả năng này. Các viên chức y tế kêu gọi cộng đồng tiếp tục nâng cao cảnh giác để làm chậm lại sự lây lan của COVID-19, đặc biệt khi bây giờ đã có biến thể mới là B1351 được xác định là đã có người nhiễm ngoài cộng đồng rồi. Khi các nhà nghiên cứu đang tìm hiểu thêm về chủng mới và những loại thuốc hiệu quả chống lại đại dịch này, biện pháp phòng ngừa tốt nhất bây giờ là phải tìm mọi cách để làm giảm lây truyền COVID-19 càng nhiều càng tốt. Vì khi virus càng có nhiều cơ hội lây lan thì càng có nhiều cơ hội để thích nghi và tạo ra biến thể mới. Đây là lời cảnh báo cho tất cả chúng ta. Các viên chức Sở Y tế đặc biệt khuyến nghị quý vị không nên đi chơi xa, không nên đi ra ngoài nhiều và tránh tiếp xúc với những người không sống cùng nhà với mình. Hãy luôn đeo khẩu trang và giữ khoảng cách ít nhất 6 feet với những người khác. Các cư dân cũng nên cập nhật thông tin về tính hội đủ điều kiện được chủng ngừa để đi chủng ngừa khi đến được càng sớm càng tốt. Hôm thứ Tư thì Trung tâm Kiểm soát và Phòng ngừa Dịch bệnh CDC đã công bố dữ liệu cho thấy là việc đeo 2 khẩu trang sẽ có hiệu quả cao hơn trong việc giảm COVID-19 lây lan. Chúng tôi tha thiết kêu gọi mọi người hãy ăn mừng Tết Nguyên đán an toàn để chúng ta không phải chứng kiến các trường hợp nhiễm tăng vọt sau năm mới. Để biết thêm thông tin về COVID-19 bằng nhiều ngôn ngữ khác nhau thì vui lòng vào trang mạng scc.gov.org/coronavirus. Xin cảm ơn. Next, my colleague Jim Bill will provide statement in Tagalog.
Magandang hapon mga kababayan. Ako po ay si Jim Bill Batuampo, Public Information Officer ng Santa Clara County. Ang unang dalawang kaso ng South African variant ay natukoy sa California at tuklasan sa County ng Santa Clara at Alameda. Ang mga opisyal ng pampublikong pangkalusugan ay naghihikayat na patuloy na mapagbantay para mapabagal ang pagkalat ng COVID-19 dahil sa mga kumpirmadong kaso ng B.1.351 na variant. Ang unang mga kaso ng B.1.351 na variant ng SARS-CoV-2, kilala din bilang South African variant na natukoy sa California, ay lokal na natuklasan sa isa sa Santa Clara County at isa sa Alameda County. Sa kaso sa Santa Clara County, ang individual at membro ng sambahayan ay kamakailan lang bumalik sa pagbiyahe sa labas ng bansa sa kalagitnaan ng Enero at unang nakaranas ng mga sintomas pagkalipas ng ilang araw. Ang dalawang tao ay sumunod sa 10 na araw na direktiba sa pagkwarantina sa pagbiyahe at nagbukod sa kanilang apartment sa buong panahon ng pagiging nakakahawa. Ang kaso sa Alameda County ay nananatiling napapailalim sa investigasyon. Ang mga opisyal ng pampublikong pangkalusugan ay mariing hindi naghihikayat ng pagbiyahe at nagpapaalala sa mga residente na bawasan ang kanilang panganib sa pagkakalantad sa sinuman na hindi nakatira sa kanila. Palaging sumuot ng mga maskara kapag nasa labas ng bahay. Magpanatili ng distansya na hindi bababa sa 6 na talampakan mula sa mga nasa labas ng sambahayan, lalo na sa loob. At manatili sa bahay hanggat maaari maliban sa mga mahahalagang gawain. Ang mga residente ay dapat din manatiling nakaabang ng kasalukuyang kwalifikasyon sa bakuna sa kanilang lugar. At kapag dumating ang kanilang oras, magpabakuna sa lalong madaling panahon. Ang CDC noong Miyerkules ay nagpalabas ng data na nagpapakita na ang pagdoble ng maskara gaya ng telang panakip sa mukha sa ibabaw ng maskarang pang-opera ay mas epektibo sa pagbabawas sa pagkalat ng virus. Ang mga residente ay inihikayat na sumunod sa mga rekomendasyon sa pagdodoble ng maskara at sa pagtiyak na ang mga ito ay mahigpit. Maraming salamat.
Thank you to everyone for joining us today for this media availability. You can visit our website for more information, and any follow-up questions can be forwarded to the PIO. Thank you very much and have a great day.